Hi, I'm Eric Kauffman. I'm an assistant professor at Roswell Park Cancer Institute, Department of Urology. I am a cancer surgeon in urology with expertise in prostate cancers and kidney cancers. I specialize in both robotic and open surgeries, including partial nephrectomy and radical nephrectomy for kidney cancers and radical prostatectomy for prostate cancers. I always was interested in cancer medicine. I think that comes from both my parents were diagnosed. My mother had breast cancer. My father had and ultimately passed of prostate cancer. And that was a big reason for me to go into medicine. And the second I went into medicine, I knew I also wanted to do cancer medicine and cancer research. So from the very get-go, I got involved in prostate cancer research. And I actually started that even before I was going to medical school. And I continued that throughout medical school and during my urology residency training and during my fellowship at the National Cancer Institute. I did a lot of laboratory research at that time as well. And ultimately, that's again why I came to Roswell Park Cancer Institute. It's a place where I could really focus on cancer medicine, but also be able to do cancer research to try to advance the field in that way as well. I came to Roswell Park because I really wanted to be at a cancer institute, a place that focused on treatment of cancer patients in particular, and also the opportunity to do research at the same time to try to advance the field of cancer medicine. So I have both clinical research projects that study active surveillance in prostate cancer and kidney cancer, as well as the surgical technique of radical prostatectomy. I also do laboratory research, which looks more at the molecular biology of kidney and prostate cancers. My research into the surgical technique of radical prostatectomy looks at ways we can improve urinary continence after the surgery. This is obviously a concern of a lot of patients who are thinking about doing the prostatectomy surgery. And the usual course of recovery after the surgery is that pretty much every patient's incontinent for a while after the procedure, and it can take 6 months or a year for them to regain that back, and a lot of patients do not regain their continence back as well. So the technique that I'm interested in studying is preserving the urinary muscles that control continence. This involves sparing the bladder neck muscle as well as sparing the urethra muscle that goes inside the prostate. It's typical for surgeons during the radical prostatectomy to not preserve either of these muscles. And while some surgeons do preserve the bladder neck muscle, it's a novel technique that I do that preserves the urethra muscle inside the prostate. So whether this is going to improve the continence of patients is still under investigation, but our early outcomes are exciting, and they suggest that it gives patients a lot quicker recovery of their urinary continence after the operation.